Good afternoon. Thanks for joining us, or me, today. We called this briefing to provide an update on COVID-19 vaccinations and to give an overview of COVID-19, an increase in hospitalizations as well over the next 2 to 3 weeks, as we know that is a lagging indicator. The increase in cases is expected given what we are seeing in other jurisdictions with the BA.5 subvariant. Subvariants are essentially due to mutations in the original Omicron variant. BA.5 does not appear to cause more severe disease than the original Omicron did, and it can evade immunity a little bit better than the original Omicron, which is why we will see this upward trend. Good afternoon. Thanks for joining us, or me, today. We called this briefing to provide an update on COVID-19 vaccinations and to give an overview of COVID-19 transmission in our province. So looking at our indicators, Newfoundland and Labrador is seeing an increase in transmission, and recent modeling suggests that we'll continue to see an increase in infections that are likely fueled by the BA.5 subvariant of Omicron. We can expect to see an increase in hospitalizations as well over the next 2 to 3 weeks, as we know that is a lagging indicator. The increase in cases is expected given what we are seeing in other jurisdictions with the BA.5 subvariant. Subvariants are essentially due to mutations in the original Omicron variant. BA.5 does not appear to cause more severe disease than the original Omicron did, and it can evade immunity a little bit better than the original Omicron, which is why we will see this upward trend. As we have experienced before, hospitalizations, even with a less severe form of disease, hospitalizations can increase simply because of the volume of cases that we see. So given this trend and the information from the modeling, we're going to maintain our current isolation guidelines. And as a reminder, it is 7 days of self-isolation for anyone who tests positive for COVID-19. And once COVID-19 activity has decreased and we see a sustained decrease in hospitalizations, we will look at reducing the amount of time required for self-isolation. We need to remember that we have all the tools we need to help avoid a COVID-19 infection while the risk of transmission is higher. Thankfully, it is summer, and a beautiful summer at that, and we can gather outdoors where there is a much lower risk of viral spread. When indoors, we can use the same tools that we've always used to prevent the spread of COVID-19. We know that masks work very well at preventing a COVID-19 infection, and the decision to wear or not wear a mask should be made based on a risk assessment that includes your age, your health status, your vaccine status, who you will be interacting with, and in what type of setting. The best protection we have continues to be our COVID-19 vaccines. I'm pleased to announce that starting Wednesday, July 20th, we will offer second booster doses to those aged 50 and older, provided they are at least 20 weeks past their first booster dose. While appointments will be available as early as next week, I would encourage individuals to consider their own risk assessment when deciding on whether or not to get a second booster dose right now. We know that 3 doses of the vaccine are quite good at protecting against severe disease, even 6 months from your last dose. And while COVID-19 is circulating now, we anticipate that there will be another increase in cases in the fall as people move inside and respiratory illnesses increase. Delaying that second booster may help provide the best protection at a time when it will be needed most. The fall may also see the availability of new vaccines that are targeted to the Omicron variant. That being said, this information must be balanced with your health status and whether or not you have risk factors for more severe disease and your risk for contracting COVID and passing it on to someone else, and perhaps others more vulnerable. So the timing of your second booster is a choice only you can make. It's not always easy, and I encourage you to consult reliable sources of information when making the decision and discuss it with your healthcare provider if you're unsure. How we look at COVID-19 vaccines is changing. We are moving away from the definition of being fully vaccinated with 2 doses because we know protection wanes over time. Boosters are necessary to maintain a good level of protection, and it is becoming more important to ensure that we are up to date with our vaccine schedule based on eligibility. I encourage parents to ensure their children are up to date with their COVID-19 vaccinations. I know parents understand the importance of vaccination, as we can very proudly say we have the highest rates of childhood vaccinations in the country. For children aged 5 to 11, up to date means receiving 2 doses of the vaccine, even if they have had a COVID infection. For those 12 and older, it means having a booster dose, even if they have had a COVID infection. Currently, about 65% of our children aged 5 to 11 and 20% of those 12 to 19 are up to date with their COVID vaccines. I know it has been a long 2 years, and we are all very tired of COVID. And still, we have to remain vigilant and do what we can to live with COVID-19. Vaccination is crucial in this regard. It is important to get every vaccine dose that you are eligible for, even if you have already had a COVID-19 infection. You should be recovered and have no symptoms at the time of your vaccine appointment. To boost your immune response, you may choose to wait at least 8 weeks after your recovery before getting your first or second dose, and 3 months after for your booster dose. You can talk to your healthcare provider about the best time to receive your next vaccine. To get up to date with your vaccines, you can check your local pharmacists and physicians for availability. To book a vaccine appointment through a regional health authority, you can do so online by visiting our COVID-19 website and clicking on Get the Shot. Thank you all for tuning in, and I hope you get out to enjoy our beautiful summer. And I'll now take questions from the media.
Dr. Fitzgerald, why just people under the age of 50? Why not make it available to those under 50, especially folks who may be concerned because they have more vulnerability to severe disease because of underlying health conditions?
So, certainly we know that the biggest risk with regard to hospitalization and severe disease are for those over 50. And given, what we're expecting in the next few weeks, we felt that that would be the best place to put our efforts with regard to second booster doses. Younger people generally have a good brisk immune response to vaccinations, and so tend to be at lower risk for severe disease. Really, when we're talking about those under 50, given our rates at the moment, I think the focus really needs to be on getting that age cohort up to date, more so than focusing on second booster doses.
There was a time when it was obviously mandatory for vaccinations. We've seen that relax, not just in Newfoundland and Labrador, but nationally, federally. Could you see an imposing of making sure that up to date, as you referred to earlier, becomes mandatory for 4 and 5 shots?
We certainly haven't had those conversations, and nobody really is having those conversations at the moment. We know that 3 doses right now is quite protective against severe disease. We know that staying up to date is very important to reduce the risk of severe disease going forward as immunity wanes, but those conversations haven't happened at this point.
Nova Scotia has discontinued its isolation requirements. Once this projected surge is over, would that be something that we may be looking at?
Yeah, so that's our plan, is to, we've always said that we have to kind of move that way as things go. It just felt that at the moment that probably wasn't the right decision to make, and that as we see a sustained decrease in hospitalizations and case counts, we'll consider that.
I want to ask about masking. When we dropped the mandatory mask mandate, people continue to wear masks. Now, anecdotally, if you look and, it feels like a lot more people are not wearing them versus ours. So first of all, is that a concern at a time when we are also seeing an uptick? And 2, are you considering bringing it back?
Yeah, so, obviously we would want to reinforce mask use at this time. We know that, This variant, BA.5, is more transmissible than the original Omicron and even BA.2, which was the last time we saw a big increase in cases. It can evade our immune system a little bit better. So it's not unexpected that we're going to see an increase in cases at all. But, we want to keep that increase as low as we can, and we also want to slow the rate of transmission as much as possible. As Omicron has taught us, there's not a lot you can do to stop a runaway train in some ways, but, infections happen, and people, have thankfully been able to get through them for the most part fairly well. But I think that we certainly would encourage people right now to be wearing their mask, to make the choice to wear the mask, especially when they're going to be in a higher risk situation.
So is there any talk of making it mandatory, though?
Not at this time, no.
You mentioned about next week opening up for appointments. So are you looking at that from a COVID clinic reopening or a vaccination booster clinic reopening strategy, or how is that going to look?
So essentially what, people can avail of vaccination and booster vaccination from their pharmacists. They can avail of it from their physicians. And then there are the regional health authority clinics. So basically, people will be able to go in and book appointments at the clinics as they always have done. But, we certainly encourage people to check with their pharmacists and physicians as well, as that may be, that's another avenue and may be a quicker way to be able to get your booster if you're choosing to do that.
You mentioned that the fall is expected to be worse. What preparations are underway to sort of prepare for that?
Yeah, so I don't know that the fall is expected to be worse. We just expect to see, an increase in transmission. So it may not be worse than what we've seen before or now, and it may not be worse at all. We don't know. We don't know how this wave is going to affect what happens in the fall, and I guess time will tell us that. But the expectation, as we have always seen, is that, as people start to move inside and, masks aren't being worn, we're going to see transmission. So right now we are certainly considering that. We're looking at what our response plans will be if we have an increase in cases that are related to something similar to Omicron, as well as looking at, what would happen if we had worst case scenarios. So, and not that we expect the worst case scenario, but we always have to be prepared for it. So those discussions have been ongoing and are continue to be ongoing.
An immunization specialist with Health Canada yesterday in the COVID task force did the media rounds, and it indicated that in Newfoundland and Labrador, we were looking at about 1,400 new cases a day right now, whatever variant that may be. One of the questions that was raised is whether or not these rapid tests are picking up some of these new strains. Are you seeing that, and do those numbers correlate for you?
Yeah, so certainly we wouldn't be surprised at those numbers. We don't know about all of those cases. Of course, that's talking about the cases in the population, and as you say, we don't, we're not testing all of those people anymore. The rapid tests certainly, as a virus mutates and as it changes from its original form, then that may have some impact on how testing can detect it. So far, PCR testing has still been quite good at detecting it. We haven't seen that issue there. And with regard to Omicron and rapid tests, I think at the moment, if the virus is there in large enough quantities and it is, in the test fluid when you do it, the test is still good at picking it up. Part of the issue may be that, with vaccinations and with this virus itself being a little more transmissible, working a little bit better up in the upper respiratory passages, is that you don't need as much of it around to cause symptoms. And so sometimes there's a lag between when you develop symptoms and when the test will turn positive. And so that's why we recommend to people that, if you have symptoms and a negative test, if you have availability of another test, then you do another test 3 days later to see what that result is. If your tests continue to be negative, but you have symptoms, you still should be staying home until your symptoms are resolved and until your fever has been gone for at least 24 hours. Because at the moment, the majority of what we're seeing circulating is COVID. So, if you have symptoms at this point, it's a fairly safe assumption that it's a high likelihood of COVID.
I want to ask about vaccines for kids under the age of 5. I know there's a lot of parents who are really waiting for that Health Canada approval. Do you have a sense of what the time frame might be, and what is the province doing in order to be ready so once that approval does come, you're able to roll them out?
Yeah, so I think it's certainly, we know that Health Canada is looking at it, and I expect that we'll see approval fairly soon. I'm really not at liberty to talk about timelines with regard to Health Canada decisions, and we are obviously preparing for that. And we have to consider that the supply of the vaccine may not be huge in the beginning. This is a completely new product, so it has to be manufactured as well. So we have to remember that. As we get more details and as we find out more about our supply, then we will certainly have more details to pass on to people.
You mentioned this new subvariant is better at avoiding immunity. Do you expect to see more COVID-related deaths as the surge of hospitalization ticks up? So
this virus seems to be able to get around there's two parts to our immunity, right? There's that initial part that happens when you first get the virus in your system and the antibodies kick in and help you to recognize that this virus is there and that you need to fight it off. And then there's another part to our immune system that works that those antibodies kind of trigger, that then come in and really help us to fight off that vaccine. That kind of immunity still seems to be working really well, and that's why we don't see the same amount of severe disease that we did before. That, coupled with the fact that Omicron tends to cause less severe disease in general and doesn't seem to initiate the same types of responses in the body that, say, Delta did, or even Alpha. So at the moment, the expectation is not that we'll see more severe disease. It's just that we'll see it be much more easily transmissible, and that the vaccine may not protect as well against you getting the virus, but we still expect that protection in general against the severe disease.
You mentioned that there's been some modeling looking at what this next wave might look like. Can you give us an idea what sort of severity are you expecting compared to previous waves that we've experienced, especially around things like hospitalization?
Yeah, so we're not expecting it to be any worse than what we've seen in the past. And, I think we fared quite well, relatively speaking, with regard to hospitalizations, and our modeling has predicted that fairly effectively in the past. So, the expectation is that it'll take a couple of weeks for hospitalizations to peak. So we may see that end of July, maybe first week of August, and, looking most likely at mid-30s with regard to hospitalizations at any one time.
Any further questions?
Okay, thanks so much, everyone. Take care. Have a good day.